My name is Roberta Valella, and this is my Module 5 assignment I am presenting to Dr. Kohlberg in Nursing 582. This will be a lecture covering about 6 different topics related to the assignment, and I will present the information in this video format as I would present a lecture to students. Okay, we will begin with the first topic, which is mental imagery. Mental imagery or mental practice can be used as an alternative for teaching motor skills. This is especially useful for individuals who have issues with mobility or issues with fatigue. Using imagery can enhance psychomotor learning through repetitive practice and by imagining or visualizing a skill without actual body movements. Psychomotor skill development can be allowed for immediate feedback to the learner. This also allows them to get an idea of how well they will perform the task being visualized. Mental imagery is used in a variety of different settings and professions. A good example of these includes sports performance. Research has proven that mental imagery is effective in increasing performance in a variety of sports such as dart throwing, diving, figure skating, and gymnastics. Healthy individuals using mental imagery may experience performance gains in areas such as strength, arm pointing capacity, range of motion, postural control, speed, accuracy, and motor skills. In addition to influencing sports performance, mental imagery has been used with patients in the rehab and recovery arena. Mental imagery can help in several ways of patients, including coping with pain, speed healing during the recovery process, preventing deterioration of physical skills due to injury or mobility, and increase adherence to the rehabilitation program. The benefits of mental imagery can both be psychological and physiological. Images of the injury can be healed, images of complete recovery, and images of performing an activity or sport without injury have been known to trigger neurophysiological changes, improve immune response, and have an effect on the autonomic nervous system. Mental imagery is effective in reducing stress and anxiety. It has been shown to improve the performance of ADLs and upper extremity use after stroke and helps patients manage pain. Mental imagery has been found to help facilitate motor recovery in burn patients also. Mental imagery has been shown to reduce stress and anxiety in pregnant women. It increased stress in pregnant women has been linked to negative outcomes such as increased number of preterm births, low infant birth weight, and developmental delays in children. In addition to decreased anxiety and stress, they found that a group of pregnant women performing mental imagery had significantly less fatigue than those who had no mental imagery exposure or training. In addition to helping reduce stress in pregnant women, it has been found that mental imagery reduced the stress levels 81% of Army Airborne in an Army Airborne division while they were performing free fall parachute jumps. Learning is a very complex procedure. Mental imagery is a way where learners can share information and opinions with others and receive feedback on how the experience went. Making mistakes is expected, but with practice, the learner can master the skills they are practicing and gain confidence in their performance. If you would like to know more about mental imagery, please go to www.physiopedia.com. There's a lot of information about how effective mental imagery can be in all walks of life and scenarios. Simulation. In this simulation, we are going to present a myocardial infarction. Simulation is an excellent way to present information about specific topics related to patient care for nursing students. Through simulation, students can practice specific skills and techniques that they can use for actual patient care. Simulation with a mannequin or a live subject to practice with can help students build confidence and learn how to interact with patients on a face-to-face level without fear of harming an actual patient. One of the most common scenarios in the acute care setting is the acute MI, or acute myocardial infarction. This situation can occur with little warning in the inpatient hospital setting or in the emergency department. Here is where I will provide you with a case scenario. Our client is a 64-year-old female who presents to the emergency department by ground ambulance with complaints of chest pain and an unproductive cough. The client has been admitted to the medical surgical unit after reporting that her pain decreased from 7 of 10 to 2 out of 10. on a 0 to 10 verbal pain scale. The client had an EKG, cardiac enzymes drawn on admission showed that these results were negative for an AMI. Currently, our client is demonstrating an increase in anxiety and is complaining of increased shortness of breath and a sudden increase in chest pain while she's on the medical unit. As nursing instructors, we are in the position to facilitate the education of our students by emphasizing the basic skills needed to perform in the specific simulation. Training with emphasis on clinical tasks will be performed in the simulation by the instructor. With evaluation and performance feedback provided to the students, we can assess the students' learning. In turn, students are asked to assess the instructor's performance to help facilitate smoother learning process as part of a debriefing session. This can be done as a group whole, individually, or in teams depending on how the simulation is run. So if you have a team of 4 students running a simulation on, say, our client here with chest pain, we would debrief with all 4 of those students at once. Debriefing can include setting the scene, what did the students observe, and asking the students about their initial reaction and asking them to describe and analyze the situation. Some questions that can promote critical thinking include: what lab values did you note during the simulation? Why are these lab values important to your client? And what evidence-based practice is important to present with this kind of situation? Open-ended questions can promote critical thinking about the simulation and can help the student think critically about the situation and possibly open up possible strategies for learning they can use in future simulations. Understanding is the key to success. When students understand the reason for simulation and why simulation is important, they are more successful when performing patient care in a safe and competent manner. Resources for this section can be found in the U.S. Department of Veterans Affairs website. It is a VHA SimLearn and How to be a Simulation Instructor. I have also shared some of this information with other instructors in my college at Dakota College of Botano, Dakota Nurse Program, Faculty Forum Shared Simulations. Our next section will discuss the ethics course statement. Our statement is: does physician-assisted suicide violate the Hippocratic Oath? First, let's define what assisted suicide is. Legislation describes it as enabling an adult who has the capacity and who is suffering unbearably as a result of a terminal illness to receive medical assistance to die at his own considered and persistent request and for connected purposes. In an editorial written by Harris, Richard, and Canna to the Postgrad Medical Journal of the Physician-assisted suicide is a controversial argument that has legal, medical, and ethical and religious undertones. Opponents on both sides of the argument are able to justify their opinions with bioethical principles. The medical profession and society in general are divided on the premise of whether physician-assisted suicide should be legalized in the United States. As nurses, where do we stand on this issue? How does this affect nursing practice? In the active learning setting, I would like each of you to provide me with a sentence that answers the question above and a brief rationale as to why you feel this way. Please provide me with some sort of evidence-based practice to support your rationale. These are statements I would pass on to my students and have them tell me how they feel about this subject. All right, with that said, we are going to play a little Kahoot game that's going to go over what we just learned. So, what I will do for the Kahoot game is record it separately and add it to this screencast-o-matic. There is no way for me to add it without going out of the screen. So, with that said, in summary, I have provided several different ways of presenting information to students in a variety of different settings, using mental imagery, using simulation, and using a game that can help provide different ways of them absorbing the information that they are receiving from me as an instructor. The ethics course statement, I believe, is a way for them to use evidence-based practice to research a problem, research something that they're interested in or something that they feel strongly about to get their point across. And with that, I think I'm done. I will send the Kahoot game your way.